Howdy, I'm Tom Schoolcraft, Mayor of Helotes, Texas. I'd like to welcome you to our very first virtual town hall meeting. The goal of this meeting is to let you know that your city government will continue functioning as normally as possible through this battle with the COVID-19 virus. All of our departments are providing critical services, and we will continue to keep our citizens and businesses as safe as possible during this emergency. This meeting is being live streamed on Spectrum Channel 21 and also recorded for on-demand viewing later by clicking on the video link on our city's website at helotes-tx.gov. Our website also has regular updates and important links to state and federal agencies where you can get additional information about the coronavirus. Don't hesitate to reach out to us by phone at 210-695-8877 or by email at publicrelations@helotes-tx.gov if you have questions or comments. Today you will be hearing from our City Administrator, Marian Mendoza, Police Chief Rob Hunley, Fire Chief Scott Moreland, and Medical Director Craig Manifold. I would also like to recognize two of our staff members who are working behind the scenes. Selena Perez, our City Secretary, is handling the technical aspects of the live stream on our public access channel and also recording for on-demand viewing later. Andrea Wazir, our Public Relations Specialist, brought us the idea for this meeting and also put everything together for us. Andrea is also handling our Facebook Live broadcast. I will now turn the meeting over to Marian, who will cover a few questions, make a few announcements before introducing the other presenters. So Marian, it's your meeting.
Thank you, Mayor. Good evening, everyone. As Mayor said, I am Marian Mendoza, the new City Administrator here at the City of Helotes. I would like to again thank you for joining us. We've received several questions, and one of the pertinent questions that has been asked is what we're doing to help minimize the spread here at Helotes. The directive that we're following is the executive order that was given out by Governor Abbott on March 19th. This can be found on the city website at helotes-texas.gov. The link is there, and you can see the full executive order. There's also been a lot of concerns on what services that we're providing, especially in law enforcement, fire, and medical services. We're operating as normal in those services and using precautionary measures. The services that we are have limited is we have asked the public to limit access to City Hall. Online services are available for certain departments such as permitting, municipal court, and you can call the city as needed. All non-essential city services have been suspended until further notice, such as notary services and fingerprinting. City Hall common areas are being disinfected regularly, and the municipal court proceedings have been canceled through April 30th. City Council meetings are being conducted as needed with limited public attendance and the use of teleconferencing. They will still be held and available on our public access channel 21, and you can go to there'll be audio live via GoToMeeting. Information on how to access the meetings by live stream and phone will be posted on the agenda, and items will be posted electronically on the city website for public viewing. This will be also available for all board and commission meetings. The Helotes Park Playground is closed, but the Helotes Fitness Park and Disc Golf Course is open. The equipment is being disinfected regularly. For city events, the Marketplace, which happens the first Saturday event, is canceled until further notice. We have canceled the Helotes Area Community Band Spring Concert, which was scheduled on April 19th. We have also canceled the Carnival Parade, which was scheduled for May 2nd, and have canceled movie nights that is scheduled for May 15th. We will look forward to resuming all city events as soon as possible. Please go to the city website, all our social media, which is Facebook, Instagram, Nextdoor, for these updates. We are trying to keep ahead of all this, and please go to our city website to get further notice. And if you have not signed up for social media, please do so. Well, I'm now going to hand it over to Dr. Craig Manifold, our medical director, who will answer some of the questions when it comes to the medical questions that we have on the COVID-19.
Thank you, Mrs. Mendoza and Mayor. I'd like to share with you a few of the questions that have been submitted to us. One of the first ones that comes to mind is, how can you tell the difference between the flu and the COVID-19 virus? And with that, we want to share with you many of the things that you've already seen or addressed in the media and through reliable resources such as the CDC, that typically with the COVID-19 virus, the symptoms will occur between 2 and 14 days after being exposed. The symptoms are a fever, cough, shortness of breath, which are common with the flu as well. The good news is that we currently treat them with similar therapies. Most people will do well and have a few days of minor symptoms and recover without any major issues. And the next question is, when should you call your doctor? And let's be honest, these days it's very difficult to get in touch with your doctor's office. We still encourage you to be able to do that, but your doctor's office may be overwhelmed or they may not be able to get to you quickly. And so we want you to follow the guidance that's provided by the Centers for Disease Control, the CDC, and treat yourself at home. The far majority of the time, you do not need testing to confirm you have COVID-19. Presume you do and treat yourself with some acetaminophen or Tylenol. You may want a cough suppressant such as the Mucinex brand products. Urgent care centers are cost effective and have extended hours. They're also available for adults and children. A relatively new process which may be helpful for you is to contact a telemedicine resource. Many insurance companies, hospitals, and employers offer these services, and there are many online telemedicine resources which are cheaper than going to the emergency department and also safer for you. You don't want to be sitting in a waiting room with a bunch of other sick patients at this point in time. Testing capabilities are increasing day by day, but right now we still need to save those tests for those who have major illnesses, such as those requiring hospitalization. You may have heard of some drive-through testing in our region for healthcare workers and others that are available for community members. These still require screening and to see if you meet the criteria, and a physician will need to coordinate the testing and additional screening will take place. You will be given a time and appointment to have your nasal swab obtained, but it still may take 2 to 3 days before you get the results. With time, additional resources for testing will increase our capacity in the local area, and you'll be able to be tested. But for right now, we need to save those tests for our folks who require hospitalization or have serious illnesses. Another question is, when should I call 911? And we want to let you know that our first responders are here for you and to assist our community. If you're having a serious medical issue, a heart attack, a stroke, difficulty breathing, please call 911. You should expect that any call we receive for respiratory or breathing problems, we'll send a crew to evaluate you. They may ask you questions before they enter the house. They may talk from you outside the door. They may ask to talk to you on the phone. And we may also be in protective gear, which can be scary for children or make it a little more difficult to communicate. These processes are to protect you and our first responders. If our call volume increases, we may ask you more questions during the dispatch process, and we may not send an ambulance for minor symptoms or illnesses, including COVID-19-like symptoms. Currently, our local hospitals will not allow visitors or family members to accompany patients unless there are extreme or special circumstances as well. Another question for us is, what can I do to protect myself and my family? I think all the things that you've heard about so far are very important in following the advice from reliable resources such as the CDC. Social distancing, covering your cough, avoiding gatherings of 10 people or more, all things that you've heard before are very important. These things slow the spread of the disease and allow our healthcare system to increase our capacity and our capabilities so we can better serve you. Washington, California, and New York are seeing difficulties with the high number of patients, and they are limited in some of their critical medical supplies today. So I ask you to please do your part. If we act boldly, we can slow the progress and allow our emergency healthcare system to work and minimize the impact of COVID-19. You as an individual in these stressful times can do things to improve your health. Exercise, eat well, maintain your emotional and spiritual health. These are increased stressors in your lives today, emotional, medical, financial. Find ways to limit your time on the news feeds. Be active, spend time with your family, touch base with a neighbor, check on the elderly on your street, support community programs such as Meals on Wheels. All of these tips will help you and our community get through this pandemic. Science is on our side and teams are working in improving the testing capabilities. A vaccine will be available in the future. You may have heard about some of the promising treatments that slow down or treat the coronavirus that are in the news today. The more we slow this disease down, the better we can protect you. And with that, Mrs. Mendoza, I thank you for the opportunity to be here today and share this information.
Thank you for taking time of your day to come and give this information to our citizens. I'd like to now introduce Chief Moreland to give us an update about questions that have been addressed or been asked from our fire department.
Thank you, Mrs. Mendoza. Mayor, I'm going to reiterate a lot of information that Dr. Manifold mentioned. One of the first things that we want to make clear to all of our citizens is that the Holoda's Office of Emergency Management is in constant, literally hourly contact with the Bexar County Office of Emergency Management, more specifically the RMOC, which is the Regional Medical Operations Center, part of the Bexar County EO Emergency Management Operations Center. With that said, the fire department has made a few operational changes to limit some of our exposure to the possibility of coming in contact with people who have been exposed themselves to COVID or COVID-19. We are monitoring the situation, as I said, hourly, and we're passing that information on to the mayor, who ultimately is the emergency management officer for the city, and making whatever recommendations that are appropriate for our city from the Bexar County EOC as well. Our firefighters and paramedics are well equipped with personal protective equipment. You're going to hear that term a lot, PPE, to deal with patients who exhibit symptoms. In addition, all of our units, both fire and EMS, are being constantly disinfected several times daily. If residents believe that they have symptoms of COVID-19, they should refrain from calling 911 immediately, and obviously call their medical provider first, as Dr. Manifold mentioned. The main thing to keep in mind there is that if we are expending resources for people who are not ill in the sense that it's creating an emergency for them and there's a definite threat to life, then we want to try to preserve as much of our resources as possible. Again, only call 911 if you have an immediate life-threatening emergency. Severe shortness of breath, obviously some of the other types of calls that may be related, being stroke, heart attack, et cetera, those types of life-threatening emergencies, do call 911 for. However, keep in mind that our call takers are going to request that you stay on the line with them. Don't call and say that you need an emergency unit to respond and hang up. We are responding within seconds of you making that call. The call taker needs to keep you on the line so that they can get more information so that our people can be adequately prepared when they arrive at your home. So chances are you'll be on the phone, or someone calling for you will be on the phone with a 911 call taker until an emergency responder arrives at your home. Be patient with us. The questioning may seem like it's not relevant, but for us it is. When we arrive at a call, we're using what is being referred to as the SCOUT process. That is, For someone that we may suspect of having a respiratory illness, we are only going to send in one person in their PPE to evaluate the situation. From that point, if that person deems it necessary for additional crew members to assist, they will come in their PPE. This whole situation is dependent on all of us working together. And I think all of us sitting up here today have confidence in our residents and the people that we serve that we will all act responsibly. And from the fire department and EMS's side of this, we plan on maintaining our high level of care throughout the entire duration of this outbreak. Thank you.
Thank you, Chief Moreland. I'd like to now introduce Chief Hunley from the Police Department to give us an update and answer the questions that have been addressed to the Police Department. Thank you.
Thank you. There isn't much I can say that hadn't already been said without being repetitive, but I will address a few matters concerning the police. The officers will be patrolling as usual, and as of now, we see no need for any additional staffing. But as this is a fluid situation and can change at any time, the police will and can change as necessary. To limit the officers' exposure, officers will maintain physical distancing as much as possible. To also limit exposure, we are considering handling some lower priority calls by phone, such as misdemeanor thefts or information reports or things of that nature. Police Department will also limit non-emergency public access to the police facility. This will include stopping some programs such as fingerprinting and the tours. The police facility is being regularly cleaned, as are the vehicles and equipment, and sanitized by our cleaning staff. Finally, the city is required to follow and enforce the provisions of the executive order announced by Governor Abbott. If a complaint is made regarding a mass gathering that does not comply with the governor's order, then Helotes Police will respond and enforce that requirement accordingly. Marian?
Thank you, Chief. Appreciate it. Mayor?
Appreciate it. As a reminder, the city of Helotes will continue to follow the terms of the declarations or executive orders issued by either the county judge or the governor. We're also following the recommendations of the Centers for Disease Control and Prevention, the CDC, and the Coronavirus Task Force, especially those recommendations emphasizing good hygiene and physical distancing. It's important that you follow these recommendations as well and to use them as best practices to keep yourself, your family members, and others safe from this virus. On Friday, March 20th, I issued a general declaration of disaster as a necessary step to allow us to apply for financial assistance from FEMA if that becomes necessary. I would like to thank our staff members and the members of the panel today for being here to help with this meeting. I, along with our citizens and city council members, appreciate your hard work, your dedication, and your leadership, especially in these times. In my 40 years as a Helotes resident, I have seen our city survive many challenges, but certainly nothing of this magnitude. Even so, I know that we are a unique and strong community and will come through this extraordinary time as strong as ever. These are desperate times, especially for our local businesses, so be sure to continue to shop for your products and services with our city businesses first. Many of our restaurants and fast food establishments are still providing drive-through, takeout, and delivery services for your convenience. It's up to us to make sure that all of our businesses survive this critical period in our history. We are all proud Helotesians, and it is up to us to take care of one another, support one another, and pray for one another. If you have elderly neighbors, be sure to check on them as often as you can to make sure they are well and have all the food and supplies they need. These are stressful times for all of us, but it is vitally important to remain calm And remember that we cannot control what is happening to us, but we can certainly control how we treat one another. So take care, be careful, and stay strong. Thank you.